while golf is a relaxing sport, it can sometimes be really hard on the body. And Don Padgett knows that better than anybody. He's the president of your Pinehurst Resort and Country Club, and you had to have some work on your hip as a result of all that golf you played, isn't it?
Well, I had to actually have it replaced, so it was major work, and fortunately I had a good surgeon, and I'm back to playing golf just like I was before.
So tell me what it was like. What did your hip feel like before you had the surgery?
Well, it started to ache a lot. You had trouble sleeping, and certainly trying to play golf, when you went onto your left side, it just kind of gave away. And so, you know, anything that was a shorter club, particularly, that you had to go down, I basically got to where I couldn't hit it at all. So, you know, we needed to have surgery, and fortunately for me, we had great quality care here local, and Jason Rivera fixed me up.
Right, and you moved down here from Akron.
I moved down from Akron, and you know, had a lot of people, a lot of connections at the clinic, the
Cleveland Clinic.
Cleveland Clinic, and I also had, you know, some people I knew, the orthopedics at Duke. And, you know, I asked a couple of questions and about your care, because it's a fairly serious operation. And basically what they said is that, you know, with the care that you can receive there, right there in Moore County, there's no need to come see us.
Right, and so your surgeon did an incredible job.
Absolutely, yeah. And the neat thing is, you know, I had the left one done, and oddly enough, I'm going to have the right one done. And it's going to be a small search, because I'm going right back where I went before.
Right. Can I see your golf swing?
Sure.
Okay. Wow. Incredible range of motion.
Yeah, it's great. You know, no pain, and you know, everything I could have hoped for, and got me back on the golf course, which was important to me, because actually before I got a day job, I was a golf pro and played the tour a little bit. So it's been a big part of my life, and something that I wanted to continue to do for a long time to come. And you know, fortunately with the care here, I'll be able to do that.
Dr. Jason Guevara performed the hip replacement surgery on Don. So can you tell me what you first noticed when Don came in to see you?
Well, first off, Mr. Padgett, he's a wonderful patient. He's been around a long time period. He's an avid golfer. And the first thing I noticed is how he was walking. Because before they even get into the room, if they have that characteristic limp of a hip arthritis, they lean to the side that's affected.
Okay.
So I saw that he had a bad limp. He was sitting down and just a little uncomfortable. And then on the exam, I could tell that he's got restricted motion and a lot of pain in that left hip.
So what was your approach? How did you tackle this problem?
Well, the first thing I do is I go ahead and do the clinical exam, find out what they've had for conservative treatment, anti-inflammatories, physical therapy, what their level of activity, and he's an avid golfer, like we said.
Right.
And so then I look at the x-rays after the exam, and I noticed that the joint space, which normally there's a big space between the ball and the socket, was completely gone.
Oh.
So he had no motion in that hip, the joint space had eroded, he had advanced arthritis, a lot of bone spurs, and at that time period, hips can go really bad, really quick, pain-wise. And so it was time that we go ahead and just replace the hip.
And now he looks brand new.
Absolutely. He looks fantastic.
Thank you so much.
Well, you're welcome.
You can learn more about hip replacements and surgery by visiting the website. It's firsthealth.org.